Nancy Lyons, I'm Vice President, Chief Pharmacy Officer for Health Mart McKesson. Yeah, it's one of my favorite things to talk about, so thanks for the question. McKesson Amplify has been described by many as a movement. Our sustained funding that the state associations are really putting into practice. In year one, they were just kind of getting to know what it was like to have barriers removed from for them. But now that we're in the middle of year two and applications are open for year three, it's just they're really understanding that McKesson is behind the efforts that they have. We know that the most meaningful changes happen at that local level. And we've seen so many things. There are industry events that they'll have where they'll get pharmacists in front of decision makers around policy to really tell those pharmacist stories. There's membership drives within their organizations to really raise the power of all the voices, which was the intent of McKesson Amplify all along. And then just really coming together to show that movement across the country. There are some things with Practice Act changes around standard of care that different associations are really getting behind, and we're just so happy to be part of that. And then a big benefit too is that our members, our McKesson team members, are able to attend the state association members and really engage and hear those stories too, and listen and support in any way we can. All of that work, helping to remove barriers for pharmacists, right? When I think about the Main Street Pharmacy Access Act, it's about ensuring payment for services that pharmacists are already doing for most critical patients that there are. The Medicare access for pharmacists to be able to bill is critical, and just as everybody's listening to this, we want to keep pushing. That bill has made it further than it ever has before, and we really need to get that across that finish line. But that's only going to be one piece of the puzzle. The work that the states are doing around standard of care is all about barrier removal as well. Many states are very proactive and have pharmacists engaged in services, and it turns it into if I've been trained to do it as a pharmacist, I can do it as long as I'm doing it safely for patients. And we're really looking forward to pharmacists having the ability to make that impact on patient care. It aligns with McKesson's, mission that we always put the patient first in everything that we do. Yeah, I guess getting started is the first thing. Advocacy, when you say the word, it sounds so elusive. It sounds like, going into some of those meetings that we see on television where there's all these heated conversations. But my experience with advocacy, and I think a lot of the pharmacists that are engaged with advocacy, is it's really just educating. Pharmacists have done education as part of their training since they were in pharmacy school, but it's really explaining it to those legislators, the impact that it has not only on their small business as an independent practice, but also again on patient care and the patients, our constituents, and making those links. But it's all about patient stories, and I just walked the show floor here at ideaShare, and we had a number of people in our AI session that is helping to simplify that, right? It's helping them translate the stories of the patient care they do every day into how to present that to their legislator. And the question about whether I start at the state or whether I start at the federal level, it's wherever you have the opportunity for somebody to listen. Um, I'm a firm believer in you have to ask for what you need. You might not always get it, but if you stay silent, no one's going to be speaking for you. And just being able to do that. Yesterday, as our McKesson Idea Share kicked off, one of our Pharmacy of the Year contestants really challenged everyone to be able to dream, right? To reimagine pharmacy. We know it best, and we have to go out after that. And I think that translates into the advocacy message so well. Everything that they don't currently understand, they need to take the time to learn about, and I am so excited about tomorrow's session. A couple of different speakers are gonna join me on the panel. One of them is a pharmacist who I've known for quite a while as an independent owner. totally focused on patient care. I visited her store. I've seen the impact that she has directly on her community, um, for every part of it. Um, if you would have asked her 4 or 5 years ago if she ever thought she would be testifying for her legislative party, she would have laughed at you. But, just what I'm going to have her talking about tomorrow is that it's just the story. It's just explaining what pharmacists do in those terms and speaking up. And, she is one pharmacist, but I'm hoping that she inspires that entire room to know that they have a voice. They all are constituents. They all have an impact on the decisions that are made, and that they can show that the patients that they're impacting also as constituents and really empowering them to talk about what would happen if their pharmacy wasn't there and the care that's part of it. But I truly believe that once a legislator experiences it, sees it, and so we're encouraging them all to also do store tours, invite the legislators to come in, spend a half an hour in the pharmacy, see the patients coming in, see the depths of problems that pharmacists are solving, and that front door to healthcare.